1:30 and you are live on YouTube. Remember, nobody on YouTube will be able to hear you if you do not use your microphones.
Okay, well, thank you, Shaq, with that. And we are going to go ahead and we'll start this Board of Health meeting. And with that, Bobbi, I'll turn it over to you.
Okay, thank you. All right, so we're going to start just with welcome and intros. And I'm Bobbi Locke, Director of Montezuma County Public Health Department.
I'm Laurel Schafer, Assistant Director of Public Health.
Kent Lindsay, County Commissioner.
Joel Stevenson, County Commissioner.
Ian McLaren, County Attorney.
And I'm Jim Candelaria, County Commissioner also.
Okay, great. Did everyone have a chance to read the minutes from July 6th? Our Board of Health? Okay. Any questions, issues, things we need to modify? Does it look okay?
I have none.
So we approve the minutes?
Yep.
Okay. So, had a little hiccup. So a little bit of change of plans for our presentation. So I've gotten some information I want to share with you in regards to our WIC and food pantry, which is what we have at the health department. This is what we were going to discuss today, to let you guys know kind of what we do with this and how busy that food pantry is. It's pretty amazing what goes on over there. So, so my apologies that our staff isn't here, but you're going to get to listen to me instead. So our WIC Cortez office, what their purpose is to safeguard the health, and approximately 600 low-income families are served that have children 5 and under in our county with that WIC program. And it's by providing supplemental food benefits, nutrition, education, healthcare referral, and breastfeeding support and promotion. We have 2 lactation management specialists on staff that in our WIC program that help support the healthy option of breastfeeding, offering, we also have hospital grade breast pumps that we will loan out to people with single-use supplies in order to use that machine in order to support the breastfeeding parents who are going back to school or going back to work, because we want to promote that as well. So another thing that we provide nutrition education with any family that we serve. Every visit education is provided in regards to healthy eating. We have a food pantry. It's a small food pantry. It's one tiny office where we have a refrigerator, a freezer, we have shelving, we have all kinds of stuff. And with our food pantry, we work with families that are struggling or low-income families who need help. And we are seeing more and more and more of that. Groceries are getting more expensive by the day, and so families are really in need. We have lots of great partners that have helped us stock that food pantry. And funding, well, first of all, the funding came from several sources, such as United Way, Salvation Army, Southwest Farm Fresh, and the Share House. And we work with food pantries. Approximately 100 boxes per month we hand out from our food pantry. Delilah, I'm sorry.
Right there in the office?
Yes, yes. It's actually right across from our immunization rooms. The door's typically shut when we're not stocking it. Yeah, yeah. It's right outside of our conference room. Yeah, yeah. So, yeah, approximately 100 boxes a month we give away. And it changes whatever is in there, because Delilah does she does all the shopping at the store for it, and she's really coupon savvy and buys things on sale, but they also have developed some menus and some healthy food recipes, because a lot of families don't know how to cook certain things, and so we try to support that as well and educate families on how to use, beans and rice and all those things. So, okay, let's see, what else do I want to tell you? Other successful local food resource partnerships in this past summer, we had lots of partners that worked with us. The Ute Mountain Ute Tribe shared many food boxes with us. 300 boxes weekly came to our community through the Farm to Table food program. They shared several pallets of food. They would send pallets up, and we would put out a message on social media, come and get it, and we would give them away. So a lot of food has gone out to a lot of families in our community this year. The Southern Ute Tribe had, through their Health Department Emergency Preparedness Office, had given us 3 pallets of baby wipes. And they were shared through WIC clients and residents of our county. And there's a lot of baby wipes we had. WIC was also awarded it's called Pamper Your Baby grant, and that is going to provide 100 families with $50 worth of diapers, wipes, and diaper rash cream. So that's another funding source that we were able to garner some funds to help families with. And one other last tidbit about WIC is currently the only agency that has a certified car technician in our county at the moment. So due to COVID, a lot of the trainings have they're not giving the trainings around the state. So we have staff just internally who are planning on taking the training, but we need the training to start up again, and they haven't done so yet. It's a federal program. So as soon as it does, we'll get people trained, but we do have Delilah is car seat technician trained, and she can install and inspect car seats, and people can just come by if they're not sure they have it installed properly, and she'll take a look and make sure things are correct, and we do a lot of education for that. So
Is that an annual certification?
no, it's not. I want to say 3 years. I think it's a 3-year certification. Yeah,
So now it's a 5 year?
it's probably more like a 5 right now, because she's still certified. A lot of the other folks who were certified, they were expecting to get recertified and didn't, and they're beyond that window. So she's still certified to do the work for now. So we're hoping they get started again, because like I said, we hired a couple folks, and that was part of when we hired them, that we were going to get them car seat trained, and we're on hold with that. So it's important, and it's an important prevention tool that we offer families. So that kind of gives you a picture of the families that we serve through our WIC and our food pantry and the food need that we have in our community. Is there anything else that I missed with that, Laurel, that you want to add to?
The partnership with CSU
Oh, okay.
and food preservation,
Mm-hmm.
teaching food preservation and
Canning.
Mm-hmm.
Drying, storage. Oh yeah. So they work really close with Greg's team too, to put on these classes, and a lot of the funding we can use to purchase the pressure cookers, the canners, that they get to take home with them and do it again. And we've even had some of these participants come back and help show other people so that they can hold bigger classes. So it's kind of cool.
Yeah, I know that he said they just completed a canning class out at the kitchen at the fairground.
Yep.
Sounded like a pretty good sized class.
Mm-hmm. Yeah, Delilah's really good at that. So yeah.
Good.
Yeah.
Very good. Well, I will be by to look at that pantry, because
Yeah.
as many times I've been over there, I've never seen it.
Yeah.
I didn't even know it existed.
It started in COVID.
Yeah, that's what
okay.
initiated it in 2020. We started it, but it's like I said. Oftentimes, the door to the room is kept closed unless we're in there filling boxes and that type of thing. So, so that leads me to actually moving on to the next thing on our agenda. Was we wanted to discuss a little bit about this Unite Us Colorado. And I don't know if you've heard about this yet. It is a referral source, basically, for community partners to sign up for. It is a free service. It's like a online platform, I guess I will call it, where different organizations in Montezuma County can sign on to be part of this, free of cost. And the thing that you spend the most time doing is what we did yesterday, was meet with Amber Bai. She's the Southwest coordinator. And let me back up a little bit. This has been going on in the state. It started in 2020. And pretty much the counties that are all running along like the I-25 corridor. They started in 2020. Our area of the state is supposed to sign on in 2021. There's a couple other spotty areas in 2021 and then everyone else for 2022. So they're trying to get the entire state of Colorado to be on this platform. And it is a referral system. So as a community-based organization, you agreed to be part of this, where what we did yesterday with her was set up Montezuma County Public Health, and we have all the programs that we want our community partners to be able to refer people to, and then also in turn it allows us to refer out to them. So I'm just going to give a for instance. Say a family is struggling with food, but they had gone into Pinion Project for another service, and they don't know where to go for food. They could, if Pinion Project was on this particular platform, they can get the client's permission, because the first time a client gets entered into the system, the permission must be received by the client. They sign permission that they are willing to have their name and phone number basically shared with another organization that could help them. Okay, so once that permission is given, then while you have that person who is needing food, and maybe they're not signed up for Medicaid, maybe they're new to the state of Colorado and they're not on Medicaid, they need help knowing who to contact. So it's a way that in the system you make a referral to, the Pinion can make a referral to us, to our food pantry, okay, and to WIC if they had a child under 5 and they weren't on WIC. And then electronically we get a notification in those specific programs that you now have a new referral, and it like dings or lights up or something. I haven't figured that one out yet, what it does, but it notifies us that we have a referral waiting in the system. You have 48 hours that you have to agree, that 48 hours on a working basis, Monday through Friday, that you agree you're going to activate that. You're not going to just let it sit there and go, into the oblivion, okay? So you have to respond to that referral. And then the other beauty of this is that it is a data source. So we as participants can pull data, and that is something that we always are looking for, especially when you're trying to find funding for redoing a grant or starting a new program. And my immediate thought was the community intervention program that you guys just approved. This would be a really good way to have that program, whoever that coordinator is going to be. I don't know if that's what we're calling the person that's going to be hired, but if that person was part of this Unite Us Colorado, they would have access to everything that's in this community that people have agreed to be part of. Okay, so we move forward with it, and I should be any day now getting a thing I have to sign, saying that we agree to do this. I asked, how do we, if we decide that it isn't working, how do we, and basically they want us to do, and they would like us to give it a year, which I am in total agreement with, because you got to give it a year to see if it's going to work or not, So plus, the rest of the state isn't on board yet either. So we need to get through next year and see how many people are on for the state. So, and I don't know, I think I only know of one organization so far in Montezuma County, which was MEC, right, signed on. I know there's presentations being done with social services, I suggested we include the veterans, senior center. A lot of county departments could be part of this because it's a referral source to help people get connected to meet their needs. So anyway, so I think it's just getting moving, just getting going, but we are going to sign up for it. And we did the preliminary work to get everything on the website as far as for our programs that we're going to have connected to it. So apparently it's pretty successful so far in the areas that they've instituted it. So we'll see. But so that's what Unite Us Colorado is. Do you have any questions about it? Okay. And I do think, so the community intervention program was approved, right?
Was approved last Tuesday?
2 weeks ago. 2 weeks ago.
Yeah,
Okay.
2 weeks ago.
And so I don't know,
They'll
Shaq's one.
start, they'll start looking at their RFPs of what, or the people that they have to get on board,
Okay,
and then who's, the RFPs for the CIP program,
They're advertised. We're waiting for the response.
so there are, some of
Okay.
those are already being advertised right
okay, okay. Because I see this as a good fit for that. So I figured if we got onto it, then maybe other county departments could join too. So, so anyway, we'll see how it goes, but the idea sounds good, and I think it would benefit a lot of folks who aren't connected. So, let's see. I think I covered all the points on that one. The data piece was really nice though, because we struggle with that a lot. When we need the data,
Local data.
right,
I mean, you can get it everywhere else, but we don't count. For some reason. Well, we count as a region, mixed in with a lot of counties.
yeah, yeah. Yeah, so I do think that, we also included like our CNC, our suicide prevention program. We put that on there. We put a lot of our programs, signed up a lot of our programs, because I do think that is
now. So then people know that there's other assistance or other help out there that.
correct.
That they don't
Correct.
know of.
Yeah.
Or
Or,
They could join.
or groups that they could join, or say you get some suicide prevention expert that moves to Montezuma County and is semi-retired but wants to participate, doesn't know how to get connected, you know, I mean, we can, there's a way through that we can get them connected. So it's all about communication and connectivity, and so if we can do that better, I think we can serve more people and help more people, so that's the goal of that Unite Us Colorado.
How
So,
long has it been going on, did you say?
well, they started it last year.
So it's very brand new.
It is.
Very new.
I feel like it's in other, is it in other states though?
It's in other states.
Yeah.
The other neat thing about it is if somebody moves away, you can refer to like WIG or, you know, I don't know, a car seat,
Mhm.
whatever.
Yeah, if they're moving to a different state and that state is participating in Unite Us, then it's just a way to get people connected, you know, because sometimes people move here and they don't even know where to start, you know, if they're brand new to Colorado and they don't even, you know, they don't know anybody, you know, it's a hard thing to do, so. Okay, so that's pretty much what I had to say about Unite Us Colorado, just letting you know that we're in the process of signing on the dotted line with that, and like I said, there's no, and if you want to look at what I signed, Ian, I can send it to you, but it's pretty, I don't suspect it's going to be anything complicated. It's not like you know, it's not like I can't get out of it at any given time. It's not going to cost us anything other than the time we took yesterday to get everything enrolled. You know, I don't really see it.
Yeah, if you want to shoot it over, I'm happy to take a look
Okay.
at it, but
Okay.
it doesn't sound like it's gonna be-
Okay. And I haven't seen it yet. It's supposed to come in my inbox any day. So, if it's like a one-page or simple thing, I probably, you know, but if it's, if it's, you know, more than one page, I'll probably shoot it your way. Okay. So,
When do we get anything that's just one page?
I know. I'm hopeful. I'm hopeful.
I live for that day.
Yeah.
You open up the email attachment and it's like, oh.
Oh, I know. And it gets more complicated by the day, I think. So, the next thing I had on my agenda was just kind of review some of the COVID update stuff. I can't come and talk to you about things without including that a little bit, right? So lots of different things. I would say our school testing is going on in 2 of the 3 districts right now. That is our state testing. It's not our testing, okay? It's CDPHE contracted with a company, and the company for our area is called Mobile Health. For our area, meaning Montezuma County. I don't think La Plata has the same company that we do, but ours is Mobile Health that they contracted with, and so Mancus is getting school testing done. RE1 starts, I believe, the 7th. I thought it was the 7th, which is this week. And Dolores has not yet opted in for it. The schools had to opt in for it. The superintendent had to sign on the dotted line for it. It is completely voluntary. Parents have to approve it. They have to sign a consent form for their child to be tested. It's open to staff as well as students, but it is not required and it's totally voluntary. But there's two options. You sign up for the full testing, which means the state contracts with this company and they do it all. That was what the agreement was. They come in, they have their own staff, they do the testing, they do the data entry, they do everything, bring all the supplies, everything, so that it's not a burden on the schools and the staff of the school. So first week in Mancus, we had a couple glitches, it sounded like, but we reached out to our state partners and verbalized all of those issues. And I believe, I haven't heard anything from Sharon on Monday's testing, so I'm assuming that everything went well.
So they
So.
started in Mancus, is that a one-time deal, or is that
No, every week.
ongoing every
It's
week?
serial testing. So, and Mancus opted for Mondays, so it's every Monday that the state is going in, and when I say state, it's the mobile health company that was contracted with the state, but it's a state contract. So they go in and they're doing the testing and all the reporting and all that it encompasses to do that testing on only those who agree, and parents have signed consent forms.
Which
So-
cereal is testing the best?
No kid has to be tested.
No,
It's just
no,
Lucky Charms.
parental consent to that.
correct, yeah, yeah. And the only glitch is that if you sign up for the full service option, then it is serial, so it has to be done every week.
So what
Okay.
is the, and I don't know if you
The-
can answer this, but what's the backside of this kind of testing so frequently? I mean, it just
Well,
doesn't
because-
seem,
Well, what they're using is they're using the BD Max. So it's an antigen test. It's not a PCR. It's not like what you get at the drive-through. Yeah, it's not the Binax, the really good machine that we have. It's not a PCR. Hmm?
It's the Binax they're using, not the BD Max, right?
Right. Oh, did I say BD Max? Oh, sorry. Binax. The Binax, the one you can go buy at Walmart. Okay, like the ones that you can just buy over the counter. That's what they're using to do this testing. It is a screening tool. It's not a diagnostic tool. And they're using it on whoever signs up. So you may get tested and you may not have any symptoms. Your parent agreed to have you serial tested, because the whole point of it is to possibly catch kids before they go to school and spread it to the rest of the classroom. So that's the point of the serial testing. So not every, like I said, not every school has signed up for it, and I think Dolores is just kind of waiting to see how it goes, you know, basically in the districts before they sign on to it, if they sign on to it. They don't have to. So it's just a way of trying to get kids not to be at school and be sharing this COVID virus. That's basically what it is. But it works best, antigen tests work best when you are symptomatic, because then your viral load is high enough that it will be picked up on it. So will they be completely 100% accurate? No, they're not going to be. So, but if you get a child who is symptomatic and has a negative test, then you probably want to go get them tested again with a PCR, because it's probably inaccurate, potentially inaccurate. Because if they're symptomatic, they should test positive on this particular test. So, does that make sense? Okay. So, and you know, again, we're not in the center of this. This is something that the state is offering, and if the schools want to do it, if it saves a kid from going to school and shedding this and spreading it, I guess it's worth it, you know? So, and
Well,
the
if they're
schools want to do
positive,
it.
aren't they already at school when they are tested?
They do it in the morning
They do it in the morning.
before they go
Yes.
Okay.
Or, yeah.
And they quarantine the whole school for 10 days.
I have questions. I mean,
I know.
Everybody does.
Yeah, no,
It's not.
we all question a lot of things, but,
We tried to do a program because these tests
Right.
obviously work better if you're symptomatic.
right,
If you're symptomatic at home, you have a test on hand that you can take before you go to school or get on that bus. But now, so we purchased almost 900. They were gone in 2.5 weeks. We did a no before you go to work, to school kind of campaign, wrapped up 2 tests per household, and people came by and got them. Well, guess what? Now the state purchased all the Binax tests that you can buy, so we can no longer get our hands on them, and they're all being used at the school. So ask me how I really feel.
How do you really
But
feel?
It really, it makes more sense to have it at home.
yeah, so you don't,
Yeah.
because, yeah, you get on the bus, you get on, I
Yep.
mean, how many kids are on a bus? 20 kids, 30 kids?
Yep.
Carpool, whatever.
Yeah.
And
Yeah.
that's why we bought them and we were handing them out right at the beginning of school and letting people, I'm like, take them home, have them home. It's just like having Tylenol in your.
So have we talked to the state?
Oh, I sent
yeah.
a nice email to the state explaining basically what they just did. And now we have this money that we're supposed to be using to support community testing. And to me, that's community testing and stopping the spread. And explaining that because they've purchased them all, we can't get them anymore. We would like you to reconsider and start sharing them with rural agencies. And
Just open it up.
yeah, and then 3 days later, they opened up a portal where you can go in and order them. That was 2 weeks ago that they opened that portal. And of course, we were on it. We did one for the health department, and then we did one for the dental clinic, 2 different entities. And we're still waiting to hear. So,
And the jail ladies.
so that's, so if they're doing them at the school, I guess that's better than nothing, but I think they could be utilized better at home when you're symptomatic.
Before you even go. No, before you
Yeah.
go was a much better system that we were doing, and then it kind of got kiboshed.
Taken over by the state.
So, so we are supporting our schools the best way we can, and just supporting whatever decisions they make, moving forward. So, which is, basically when we got the feedback from Sharon and Mancus of some of the hiccups they had that first day, we immediately shot our concerns up to the state, and they met with the powers that be, and it should have been better yesterday. And the fact that we didn't hear anything from her, I'm assuming it was improved. So,
how many are in school in Memphis? So is it just the high school, or is it the whole school?
the whole district.
So basically K through 12?
Right, in Memphis, it's all one. Yeah. I don't know how many students there are.
Couple
I
hundred?
have that at home. I don't even think it's a couple hundred. I think it's like more like 100 and,
100? I mean, I'm just guessing.
I, so, and then there was the other option, not the full service, where basically they provide you the supplies and then the school got to do everything else. Well, that was not attractive at all for schools, because it really put a lot of burden on the staff last year when they started doing testing. So, so anyway, both the school districts that opted in did opt for the full service.
What about daycares? Is anything going on with the daycare?
That's a good question as far as testing goes.
Yeah.
I'm sure they're in the same boat where they don't have
don't have anything
access
they
to
can
Binax. I have no doubt they are. Because we're seeing cases everywhere now, everywhere. So, yeah. All right, I talked about that. So as far as the hospital testing for community testing, they are busy. And the line just gets longer by the day. They they do have this posted on their website, that you can, the drive-through testing is Monday through Friday, 10 to 2, no appointment. And they're lined up at 10 o'clock easily. I mean, the line goes way far. So they're definitely doing lots of testing. And I think yesterday was our big day, our highest day for the number of tests that we sent out. So lots going on. Lots of people are symptomatic. They're not just getting tested because they're curious. So pretty sick folks. You can also get tested at the walk-in clinic 7 days a week. The hours are like Monday through Friday, 8 a.m. to 7 p.m., Saturday and Sunday, 9 to 5, but a provider visit is required. So my understanding about that is you go to the walk-in clinic, you're going to be seen by a provider there as to why you need a COVID test, and then they'll do the COVID test. So, and of course, obviously if you're having trouble breathing and it's an emergency, the emergency room will test as well, but that's like a last ditch. We don't want people running in the ER if they don't need to be done in the ER. For pre-ops and travel, that is done through the lab at the hospital, Monday through Sunday, so basically every day of the week from 7 a.m. to 10 a.m. So no appointment necessary. So every day during those hours you can get done at the lab. So there are numerous testing options for community members and for the schools. So that's kind of the testing update. Vaccine. So as far as vaccine goes, the only booster that's approved is the Pfizer right at the moment. We are doing, actually we're having one today, right now, a Pfizer booster clinic at the health department. We have all the vaccine. We have Pfizer, Moderna, and J&J, and we're giving, some first time and some second dose shots today too. So the hospital's providing vaccine too. So there are places to get it if you want to get vaccinated. Then I think that's all I'm going to say about boosters. We are anticipating that Moderna will be approved, but we've kind of been looking at our own little internal log too at the breakthroughs, and it's what the state has been putting out too, that it seems to be, it's not putting one vaccine better than the other, but we do seem to be seeing more breakthrough cases with Pfizer than we do Moderna. So, and just for our own little internal study, it's about twice as many Pfizer breakthroughs as we were seeing in Moderna. But that's just our little microcosm within the health department. So, but it's definitely looks that way. Now there's a lot of theories as to why that is, but I don't really know why, but that's kind of what we're seeing. So, mid to late November, we're hearing the Pfizer for 5 to 11-year-olds emergency use authorization is supposed to come through. So that's what we're hearing. So we'll see if it stays on that track. But again, it'll only be emergency use for now. So there may be some parents who will get their kids vaccinated, and of course there's going to be parents who don't want to do that. So again, it'll be up to them. So let's see, a couple little updates as far as the state website. When we look at the state website, the vaccine rate for our county, as of this morning when I went on to look, for one dose of vaccine is 69.3. And for up to date, that's what they're calling it now, is if you're up to date, meaning you've gotten your full 2 doses, or if you got Pfizer and you're getting a booster, then you would be considered up to date. But they don't, that's just started, so there's no numbers for that yet. But we're at 60.4. So for one dose at 60, for full dose, 60.4, one dose 69.3 for our county. That's for Montezuma County. And when we do our own positivity rate internally, today it's sitting at 27%. So that's pretty significant for our county. That's today's numbers.
So what does that number mean?
Yeah, so it's basically when we take the total number of tests that were done. So between, you know, what was done in the lab, what was done through the drive-through, what might have been done somewhere else, but they're Montezuma County residents. So you take the total number of tests and you have the total number of people who are positive out of that. So the positives divided by the number of tests by 100. And so that's your percent positivity. Of all the people who were tested, this many were positive.
Even though many of them were tested multiple times just because they had to be.
Yeah, but there's.
So it's not a true representation of positive.
No, I see what you're saying, and you're right.
Within the
Representative
community.
of 100 people in the county.
It's the positivity rate of those that were tested.
Right,
Correct.
of just the ones
It's not.
No.
So those are really skewed numbers.
And
If you're looking at those for, this is our county as a whole,
no,
It's
we're
not a true
it's
picture.
we're not doing it as a whole. It's the positivity rate for those who were tested
correct.
So the 100
yesterday
100
in
people
our
went through the
county.
drive-through yesterday, they're saying 25% of those were,
27.
27 of those people tested positive.
I think it's such a deceptive way
Very
that they
deceptive.
frame it
Yeah.
and the way that they present it. It's very deceptive. It's difficult to
Well, and
reconcile.
that's just, that's just us internally looking at our positivity. I didn't get that from the state. Okay, that's just us looking at the tests, the number of tests we do and how many are coming back positive, period. Like it's that cut and dry. I'm not looking at, 28,000 people, and how many of those people is their 10th test. I don't know that, but because we have situations now, right, where people are having to get tested for their employment, right? So that's going to bump the amount of tests that are, we're not looking at, they were done on Tuesday, so we're not going to count them today since it's Friday. I'm not a statistician. I'm not wasting my time looking at that kind of thing. I mean, that's just not a good use of time for us. But that's just to give you an idea of how, there are a good chunk of people that are going through that line right now that are symptomatic and sick. They've got it, so.
That's probably where I'll catch it, is over there sitting in that line, all these sick people.
I hope not, but
Knowing
I can
you,
stay away from everybody, whoever.
I know. It's so challenging right now.
you got more antibodies than you know what to do with. You could probably donate.
I got tested for antibodies, and I should find out tomorrow what that test.
I got tested for
And
IQ,
that's-
but it came back negative.
But whatever the antibody test says, it won't
Well-
matter in terms of moving forward.
No.
right? Yeah.
Well, and they don't really have a clear understanding of what the antibody tests mean either.
It
they
means you
don't.
have antibodies that respond to
Yeah,
COVID-19.
and what number is enough? We don't know. You know what I mean? Like, so there's so much that they're just collecting and trying to learn and make sense of, and, maybe 20 years from now they'll have it figured out.
Well, I've probably got enough COVID vaccine from cattle vaccines over the last 50 years that there's no way I'm going to catch it.
If you quit drinking it,
Now, when I look at the state, and what they post as their positivity, theirs is lower, and I think they are, and I don't know their calculations of how they're doing it, but to me, I think they're taking the 28,000 people into that. I don't know though, for sure. But it sounds to me, yeah, per 100,000 people. They base everything on 100,000, even though we don't have 100,000. So, I think that's how, because we're sitting at 8.6 with the state right now, so,
Positivity
yeah.
rate.
So I think they're
Per 100,000.
taking it.
Well, they
use 100,000.
They use 100,000, but
As
they
the
go
base.
off of 28. It's
Right.
Cody and I did the math one day because we knew I wanted to see what it was,
Yeah.
and so he and I did the math with Cedars, with their numbers
To
with our
truly
numbers
check.
to make sure.
Yeah.
And we were off like 2 numbers one day and 2 numbers the other, 2 tests. So I think it's pretty accurate. And since we've been doing our own internal positivity rate of the tests that we know of that were completed, it averages 14% since,
Right, on average.
since the mid-August.
Yeah, yeah.
So, but again, I could go get tested somewhere else.
Sure.
Yeah, I mean, we don't know who's getting tested where. We only know the positives. I mean, you know, that's what we know. So, okay, so then, and I think I told you about our phone call with the state. So we had a phone call last week, just to let you all know. Scott Bookman, who's the incident commander for COVID with the state, and then Dr. Rachel Herlihy, who is the state epidemiologist, and along with 2 other CDPHE employees, had a phone call with us in regards to their concern of the increasing cases with youth in particular, which we are seeing with the schools. It's just inevitable. There's definitely kids that are spreading it around in the schools. And then they were also concerned with our hospitalization capacity. It's not just ours, it's the state. They're looking at the entire state and watching numbers of beds, ICU beds. And when they compared kind of where we started, where we were last year at this time, apparently there were more hospital beds, ICU beds available at this time last year than there are now. So, and that's not due all to COVID. It's just the reality of what is going on. You know, people in general are just, there's a lot of people that are sick, a lot of people that are needing critical care right now. So, not all COVID, but, you know, it's happening. So
Well, the baby boomers are entering an age where they're going to require more care. I mean, like George, his report was, he's seeing a lot more deaths in 60-year-olds lately, and that's
right,
all of those people that were born out of the 40s and early 50s
right,
are in that bracket now.
right. And we're seeing a lot of uptick in the kid COVID cases, but we're also seeing an uptick in the young adults that have their parents of these kids who are,
Yeah.
because we're seeing a lot of households that are sick right now, you know, and so everybody in the household pretty much gets it, you know. I mean, it's not a guarantee, but there is definitely a trend there, you know. So that age group of the parents we're also seeing an uptick in cases there too. So it's just what's happening. And the phone call that we had was not punitive. It wasn't prescriptive. It wasn't telling us what we must do here. It was not that at all. It was a conversation to let us know kind of what they're thinking, what they're looking at the state. They're going to be watching the numbers, see what's happening in our community. Our schools just recently, so Dolores is remote this week. RE1 put in a mask mandate for 2 weeks, this week and next week. They're all trying their own internal mechanisms to try to, you know, reduce some of the spread. You know, there's some staffing issues that are non-COVID related too going on. So there's just a lot of variables happening. And, you know, I think our districts are doing the best they can given the situation. And so, and those 2 decisions with those districts, we did not share with the state because that hadn't happened yet. But, you know, they said they would be in touch in 7 to 10 days. They said I would be getting a letter from Scott Bookman. I'm still waiting on that. Haven't gotten that yet. We had that call last Thursday, wasn't it? Okay. So, again, there was nothing forceful about this. It was strictly letting us know the concern that they have, and they're targeting communities that have increased case rates, plus areas that are rural and areas that have hospitals in them. which we fit all those. So that's why they had the call with us. And they were talking to several other counties that day, including San Juan Basin that morning. So, so I'm just letting you know that that did go on, and when I get the letter, I'll surely share it with you guys so you can read what it says. And again, it's all about the potential impact, you know, because I mean, our community, you know, it can be somebody gets, you know, in a accident and, you know, has a massively broken leg, something we can't, and they have to be sent out somewhere else, you know, with a major artery that's been impeded. And so we're, you know, if there's no ICU beds, then that's a problem. So that's kind of what their concern is about. It's not necessarily just COVID. And so, you know, they're supposed to be giving us, I haven't gotten that email yet either, in regards to being able to see what is actually going on with the hospital bed capacity, but we should be getting that soon. So, because, you know, everybody's busy. I mean, the EMS at the hospital they're doing 50 million things, and everybody's helping out with the drive-through, with the testing line, and everybody's stretched thin. And so I don't want to ask the hospital, put one more thing on somebody at the hospital and saying, can you send me where you're, you know, this way I can just access it and I don't have to ask somebody for the information. So anyway, again, that's kind of where we are with the state at this point. You guys have any questions about
The
any
state?
of that? No, but I will say, you know, the next, if we have to have another phone call, would you like to be part of
Sure.
that? Or do you want me to just, I mean, I can just handle it again, it doesn't matter. I mean, this one was
No, I mean,
very,
I don't
very
mind listening in or-
it was not, this one did not really rise to that occasion. Now, if
This
we
is-
have to have another one,
Yeah.
not sure.
Right.
Here's
because-
the numbers, here's what we're thinking, see you later.
But it really was, it was a good conversation. Jill Ryan wasn't on the call. It was like I said, Scott Bookman and Rachel, Dr. Hurley. So they're just concerned, that's all. But they're concerned in multiple, we're not the only concern, the entire state,
Sure.
you know, so.
Okay.
And the trend is, I mean, when you look at the numbers around the state, like just looking at COVID, I mean, it does seem to be improving. The numbers do seem to be slowly going down. So why that is could be any number of a guess, you know. More vaccine rates are going up, more people have had it. You know, there's a million reasons why that can be happening, you know.
In other words, the virus is running its course.
And it will.
So, yeah.
run its course.
Yeah.
So anyway.
Natural immunity's kicking in.
So I don't know, but I believe that, I mean, our schools are doing, we have a health advisory meeting with them every other week, and they're doing all that they can possibly do, and I think they're doing a great job navigating it and trying to keep kids in school and just trying to move forward and educate the kids best they can.
Yeah.
So, anyway. So,
In school,
yeah.
educate them.
Yeah. Anyway, I don't necessarily have anything else. And do you have anything to add to it? Anything I've said? Okay. And again, I apologize for not having our WIC folks here, but that's just kind of the way
That's
things
okay.
played out. Do you guys have any other questions? Any other concerns? Anything? Any worries?
I don't have any worries. I mean, I don't think any of us are worrying about anything. It's just trying to make sure we're going down the river in a positive manner, in a positive way to keep to keep going.
Right.
You know, every time I hear the state on these calls, it gets me a little cautious because I know that they're a little reactive instead of just letting some things play out that kind of need to. I mean, trust me, I believe in science, but sometimes you have to use common sense with science, in my opinion.
Yeah, and it's, I mean, I don't know if you've ever seen one of their slideshows that Dr. Hurley presents every week. The amount of work that goes into those slideshows every week. I mean, I know she has a whole team that's gathering all that data, but there is a lot involved in that, and they're studying so many aspects of this. It's just incredible. And, you know, and it's, you know, they got county specific stuff, so you can kind of see in the region what's happening in your region, you know. And then, of course, you know, the other issue we think about too is, you know, one of our neighboring counties, you know, they're struggling with the number of cases, and they don't have a hospital, but they're, you know, I believe that they go to other hospitals on the other side of the state line. So, you know, that's where they're getting a lot of their care, which, you know, but being aware of our surroundings is important too in this whole thing, right? Because we live in the Four Corners, so we've always had that issue since the beginning of COVID, you know, with this whole process. But it's what we deal with here. And
But I also think that, you know, it was proven through COVID that we don't have that much interaction that everybody thought we did. I mean, yes, people cross the lines every day. I understand that, but as far as the real interactivity, that I don't think there's that much. People cross the line, do what they got to do, and then they get out of here.
oh, I see what you're saying.
So there's not a lot of, you know, like big group meetings or something like that. It's not like they're together.
Yeah.
What about other communicable diseases? Anything sticking its head up? Flu, TB, anything? Hepatitis?
As far as, well, we've had a couple TB cases, but nothing, you know, out of the ordinary. And I don't believe, if we've had a documented flu case already, I am not aware of it. Periodically, they're doing flu testing. There's a certain test that they run in the ER that they'll run flu A and B on a COVID test. So, but they're not routinely doing that yet. So, but that is one of the big concerns is flu and RSV for this season, this upcoming winter. They're anticipating more of both of those.
What if you had them both at the same time?
Yeah. I don't know about that diagnosis, but I'm not sure.
Our epi nurse is looking, there are quite a bit of syphilis cases in this.
Yeah, that's a
kind of concerning. So she's working on that.
yeah. So and those are big issues that, you know, if left untreated, you've
Yes.
got bigger issues.
I mean, we could be looking
So-
over here and something pops up, so I don't want to be
Right.
caught off guard.
Right.
Yeah.
Right. And I agree. I think we have to, you know, obviously, I mean, COVID's important. There's no question. But there's a lot of other things that we do in public health. That is not the only thing we do. And we do. You're right. We need to keep our eye on all these other potential issues. And every day we deal with stuff. We deal with environmental stuff. We deal with other immunizations. It's not just COVID vaccine, you know, so.
When did you say your flu?
We have it.
Oh, you
I
do
said
have
I
it.
didn't because I didn't think we did. Well,
Okay, you do have it now.
we do have it, yes.
So everybody out there, that if you do want one or need one, get a hold of you ladies.
We
and-
probably need to figure out a count, because we usually do a flu clinic for county employees. So we need to get that scheduled. So, yeah, now that it's October. We usually don't do flu vaccine before October.
Right.
So, just so it'll carry you through, you know, the
And
flu
the only
season.
reason I asked that is
Yeah.
because the last time we talked to us.
Right,
we didn't-
and I didn't realize we had it, so I
We
didn't
can-
mean to tell a little white lie, but I did.
Oh, that's all right. I
Sorry.
was just asking. I was thinking maybe it would show up
A
next
little
week.
tiny lie.
Pneumococcal, pneumonia shots available?
So it's the pay source, right? Medicare.
Yeah, that's shingles. I think we
Right.
can do the pneumovax. And then
No, but I mean, so do we do it for anybody?
it's.
But if you're
yeah,
Medicare, no.
But if you're
Right.
Medicare, no.
Right. If you're Medicare, you have to go to a
Provider.
private. Yeah. Yeah.
Medicare charges $2,500 a year to
We used to do flu vaccine for Medicare, and then when Medicare did that, we can't afford to pay that fee
Right.
to be a provider. So, you know, hopefully, before COVID hit, one of the things that was on the table for Medicare was covering dental,
Yeah.
which they were considering having dental coverage, which would
Right.
be awesome, because that is a population that's very much underserved. So, and I just recently, either on an email or something, heard that brought up again about.
I seen that come through
Yes.
on something. I don't know
Yes,
what it was.
so I don't know if that's going to resurface. I hope it does. And if it did, then I think we would look into, because we'd have, I mean, our dental clinic could serve that population.
Right.
As well as, you know, us be able to provide vaccine for Medicare age folks. And I know it was really hard because we had a lot of people who always came to us for their vaccine, and then we had to turn them away because we couldn't afford to pay that fee. You know, that was kind of ridiculous. But it might pay off if we're doing more than just flu vaccine. So,
And we don't turn everyone away.
no.
If somebody comes in and you can tell it took them a while to get there.
Yeah,
And they
yeah.
want their flu shot, they're getting their flu shot.
Yeah, we don't.
So.
We just don't
I know.
advertise.
Send them away and tell them to go somewhere else.
Right.
When I turned a certain age,
Yeah, yeah.
the
25?
medical- Yeah, medical
Okay.
provider says, well, I recommend you get this, 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 this.
Mhm.
I thought, I'm gonna be a pincushion before I get out of here. Your turn's coming. Just wait. You know, it's no longer just a pneumonia shot, you had two,
Nah, I don't know about that.
you know. Oh, you should get a flu shot every year. Get a shingles shot, yeah, oh, yeah.
Yeah, but flu shots were recommended through the fire service every year for us
Yeah.
for the last 30 years. It was never a requirement, but they always recommended it for us.
Yeah.
The hepatitis B was a requirement.
Yeah,
Mhm.
Yeah.
Right.
Flu shots were just encouraged.
I went through hepatitis B 3 times for
So did I.
Oh, really? You
before
didn't
it
get
took.
enough?
Yeah,
Huh. Wow.
3 times, and I still have 0 antibodies.
Huh.
Yeah, I'm done.
Wow. Third time
Yeah,
wasn't a charm.
That wasn't a
Mm.
charm, and then they said, okay, fine. So it doesn't always mean that it's gonna,
Right, right.
it doesn't mean that,
There's no guarantee. And it's the same with it's the same with the COVID vaccine, you know, there's no guarantee that it's, you know, it's just, that's what the percentages are all about with the efficacy of it. And there's no vaccine, it's 100%. So, it's just the way it is. So,
This year the flu is 30%.
that's what they're saying. Efficacy for the flu this year.
30% what?
That it'll be effective.
it's 70% that you're gonna get it.
Yeah, that's pretty
That's
much
what
what
they're
they're
saying.
saying. Mhm.
What is it normally?
It's way higher than that. Like it's close to 70 that it works. But this
Like, do
year,
they cut the cost by whatever percent?
oh,
thinner
you're
with
clever.
alcohol,
Ian,
Just
that's-
kinda
no,
curious.
and you know, when they developed it, and I've never worked in a lab, so I don't know, but I do know that they develop it for the next year. Like they look at what flu cases are going on this year, and they're in anticipation, and that's what they develop for the following year. So, you know, last year flu cases were definitely down. So they developed it off of, I'm not sure what they developed it off of, but this year they're anticipating that it's only going to be 30% effective. But I hope that people don't let that discourage them. I think that they should still get it because they are, and maybe that's partly why they're anticipating more flu cases, because the efficacy is so low. So it might be something that goes hand in hand here. So that's another reason why the hospitalization piece is such a concern. So, yeah, I don't know. Just putting puzzle pieces together because I don't really know that.
So take good care of yourself.
Yeah, wash your
Eat
hands.
right,
Wash
well,
your
right.
hands.
we're back to, it's still back to the basics. You
Yes,
wash your hands.
yes.
Very
Yes.
basic.
If everybody just washed their hands 2 or 3 times a
Keep-
day,
Every
Keep
time
yourself
before you
careful.
eat, every time
Yeah.
this goes here. Yeah,
touch your face, you know,
yeah, yeah,
if you
Don't
can
touch your
possibly
face.
achieve that.
yeah.
Not achievable.
Well, I don't have
Nose on the
anything
dirty
else.
finger.
So, do you guys have anything? Goodness, we're meeting again in January 2022. Sounds so far away, but it's really not.
No, it's not.
No. So, if you have something in particular you want to discuss, let me know. I'll just do my normal and I'll email you a week before, see if you have any ideas or something that you
Well,
want me to.
Yeah, we'll know in the next 3 months.
Yeah.
Hopefully everything is good. It can be short and sweet.
Yeah.
All right.
Okay. Thanks.
Very good. Thank you, ladies.
Thank you, guys.
Thank you very much.
Have a good day.
Yes, we will.
And I see that our DA just walked in.
Oh, yes,
Okay.
yes,
Well, there you go.
yes. No, we're actually done early here, right? For,
I think you can close the YouTube. I think we're done, gentlemen.
Yeah.
Yep.
Okay,
I think this meeting is adjourned.
okay, thank you. Yes.
I think we're good.
Okay, we're back live, gentlemen.
Okay, we're gonna jump back up into our agenda. We do have Commissioner Stevenson back with us here this afternoon, and we're gonna look at unfinished business. And I believe the administrator had a question on direction as far as the maintenance director?
Foreman.
Is that?
Yep,
maintenance
you interviewed,
Foreman. So we had interviews last week. We had 2 people that were interested in the position. And were the applications left open until filled, or how did we advertise that?
we did leave it open until filled. We had it open for 6 or 7 weeks and only got 3 applicants, and one of them withdrew, so you're
Withdrew,
down to
right.
the 2 you interviewed.
So I guess that's all we have under unfinished business that we didn't take care of earlier. So gentlemen, what's your pleasure? Which way do you want to go? Do you want to leave it open? Do you want to wait for more? We had interviews. Do you want to work to a point now?
I think we can fill it.
I think so too. I think it's been open for 6 to 7 weeks, and if there was anybody out there, they would have come in by now, I think.
Okay.
All right?
Well then, do we want to discuss any of the 2, or are you ready to?
I'm ready. I think that as a county, we should hire from within to start with.
Okay. Anything else that you
No,
want to add, Commissioner?
I agree with Joel. We should just promote from within. You want to make the recommendation, Joel, or the motion?
We will have to get with Shaq though, because there was a question that was asked of us, where actually as far as salaries.
Yeah.
So
I
that's-
already took care of that.
Did you?
Okay.
I mean, I haven't presented it to him, but I looked it up on the spreadsheet, and it
Okay,
would
because
be entry level
we
at
haven't
that
seen it, and
position.
that's something that we're gonna have to approve as far as,
Yeah.
because that then becomes our responsibility for.
I'll put
ensuring
that
that-
up on your screen real quick, just so you can see. Give me just 1 second.
I guess we could go ahead and move it forward as to the person that's being presented to hire, and then leave that as far as the salary. We could even do that when you get done with that, Shaq, if you don't.
That's not the one you want to look at.
No.
Mhm.
Whoops, that's social services.
Which
Yeah, I
is,
don't have
which,
it on
like I said, we can approve that salary next week, can't we? Yeah, because that way you can have time to pull that up and look at it. But I think the decision we can move forward with now is to whether to promote within and name that person and get them going, and
Sure.
and then in the next day or 2 we can deal with salaries. Okay.
Well, I would move that we hire Dustin Sadler as our maintenance supervisor.
Second.
I don't have anything from here, so. Okay, so it has been moved and seconded that we promote from within and that we hire Dustin Sattler as our new maintenance supervisor coordinator. And all those in favor?
Aye.
Aye.
Okay. Motion carries.
And just so we're clear on the minutes, did you vote, Jim?
I did not.
Okay. I just want to be sure we get it in the record.
So I have in front of you what the minimum is for that position based on our wage study. And if you guys want to think on that, that's fine, but that is what the minimum is.
Yeah, I think we can look at the comparisons for, is this last year? Or these are just based off of these numbers that you've given everybody else?
Correct.
Yeah.
Yeah, so I'm not sure we should make that decision right now. Why don't we take a day or 2, look at them, and then see what you guys come up with?
Sounds good.
And then Joel, did you have a report or should we adjourn the meeting?
It was a pretty slow week this week. We didn't have a town board meeting last week and so,
So there are no other meetings this week, are there? Does Cortez meet tonight?
No.
Oh, no, we're on the odd,
Yep.
on the off weeks. So no,
We've
then
got,
if you don't have
Thursday.
anything else, we can,
this Thursday, we got quite a bit coming up, but
okay.
Lauren Bobert's representative will be here Thursday afternoon.
Correct. All right.
All right.
Okay.